You see, when you are exposed to a normal AQI, then probably there is not much effect on the. But as you grow, they usually contain the air particulate matter, which is given a number like less than 2.5 micron and less than 10 pm 2.5 and less than 2.5 micron. If you are having cough which is not getting better, which or you feel that you are feeling breathless, you must consult a doctor.
Hello viewers, I'm Kavya Khandelwal and you are watching The Edge, and today we are here at Indraprastha Apollo Hospital, and with us we have Dr. Rajesh Chawla, who is Senior Consultant Pulmonologist and Critical Care Specialist at Indraprastha Apollo Hospital. Thank you so much, sir, for joining us. Sir, we are here today because living in Delhi NCR is more like inhaling very toxic air every second. So, sir, regarding this, my first question to you is, how does long term exposure to high AQI affect the lungs of a healthy person?
You see, when you are exposed to a normal AQI, then probably there is not much effect on the. But as you grow, like if the AQI rises, and the kind of AQI we have in Delhi NCR, it is always in a very poor quality. It has a lot of impact on your body. And first let me make you understand that what it contains. The air pollution comes from various resources, like that it is the vehicles, number one, in Delhi NCR, because we have very large number of vehicles. Then the factories, the industrial pollutions, then the parali, which every year during winter months adds on to this. Then the burning of coal, and also we have a lot of indoor pollution also, because we do a lot of cooking and they also add on to the pollutions. And if you have leakages in the house, radon gas also comes into this. So these are the sources of pollution. Now they usually contain the air particulate matter, which is given a number like less than 2.5 micron and less than 10 pm 2.5 and less than 2.5 micron, which is the very lethal and gets into the deeper part of the lungs, and it gets into the blood and causes all its side effects. Similarly, we have a lot of gases. From vehicles, we have nitrogen dioxide, and then there are sulfur dioxides and the ozone in the lower surface. Then there are carbon monoxide. You feel headache in the evening. That's because you are exposed to very large amount of carbon monoxide and carbon dioxide. So these are the constituents. All of these, when they are in a higher quantity, when their numbers is in a higher level, in a lethal level, they cause a lot of side effects on the body. So they definitely have a lot of side effects on the body. For every gas, there is a different effect, like nitrogen dioxide and sulfur dioxide, very irritant gas. And over the years, when person is exposed to nitrogen dioxide and the sulfur dioxide, you develop lung diseases like COPD. Similarly, the particulate matter, it is also very lethal, and it causes lung diseases like chronic obstructive lung disease, and these are also the risk factors for your lung cancers. These are the two very important. And if you're already suffering from a lung disease, then all these pollutants, when you are exposed to a high level of pollution, you get an acute attack or acute exacerbation of that disease, and you need to visit the doctor. That's why the visit to us have really increased about 20-25% by the respiratory patients. Of course, the normal patients, people who have never had symptoms, they do come with the fresh symptoms, but majority are the patients who are already suffering from the respiratory illnesses. Similarly, it has impact on the heart, it has impact on the brain, because people have reported that there's a neurodegeneration, your memory goes down, the old age dementia occurs early. Similarly, it has impact on the lung cancer. Lung cancer is one, but people have even reported breast cancer. Chances of getting breast cancer are more. So there are a lot of side effects of this. But the problem is, every day you don't get an impact. It's a long-term exposure which causes these diseases. So there are really large effect on the body, and it is also said that person living in the NCR, Delhi NCR has a average lifespan which is 7 years less than a person who is staying in a good area.
Very true, sir. But this is a very new thing that you told me that not just lung cancer, people also suffer from breast cancer because of the pollution. So, my next question to you is are the health effects of short term, like if we are outside for few hours, is different from long term exposure from the air pollution?
See, in Delhi, most of the time the levels are not very low. They are always high. You're already exposed to a higher level. But during winters, during November and December, when you are exposed to very high effects, you have a burning in the eyes. You have a throat which is itchy when you go home. You feel more tired. These are all the effects of your efficiency goes down. आप काम उतना नहीं कर सकते हो इस दौरान आपको suffocation सी feel होती है. These are all the effect which you see during winters. So even a small person the labor who is working outside for a long time, he definitely over the years will have some impact. Problem is you don't get an impact on a day, so you feel probably the air pollution is not affecting me. It is affecting everyone. What we see, I'm a pulmonologist, so when we do lung surgeries and we happen to see the lung, they're black. There are black patches all over. And when you see the lung of a person who's come from, say, let's say, from hilly area or any other country, they are pink. So that is the difference. I'll tell you one example. You clean your plants and you see the next day they are dusty. So if the dust is sitting on the plants, it's going inside your body as well.
Very true. So, what exactly happens inside our lungs when we inhale PM 2.5 or PM 10 particles?
I've already told you when the immediate effect is irritations, PM 2.5, when it goes into the lung, it goes into the deeper part of the lung, and there is oxidative stress and it causes inflammation. And these particles get into the blood also, and then they have an impact on other parts of the body. And that's the basis of how these things, the particles, they cause disease. Similarly, the gases have an impact which are more immediate, but it's the dust particles which over the long years when you are exposed to, they lead to the COPD and the diseases of the other organs.
What are earliest symptoms that should people take seriously in this pollution season?
If you are having cough which is not getting better, or you feel that you are feeling breathless, you must consult a doctor. These are the immediate effects. And one of the major reasons why I'm saying this is because these are the early signs that the pollution has started affecting you. Not everyone will suffer. You may feel a little suffocated. Your exercise tolerance may go down. If you are running, you may not be able to run that much. So these are all the signs that the air pollution exists. Keep on seeing AQI and don't go out to exercise if you have that.
Similarly, the schools have also said no to their students from outdoor activities. So does N95 mask really makes an impact, or does it really protect you from PM 2.5 particles? And if there are better alternatives, please tell that to our audience.
See, it is always better to have something than nothing. So, if you put a PM, the N95 mask, it definitely protects you from PM 2.5 and other particles, but the gases would still go in, but there is some protection than no protection. Similarly, the air purifiers inside the AQI would be very low, and you spend almost half your life inside. So if you are at home and if you have air purifier, and especially if you are a person who is suffering from an illness, you will definitely feel better if you have air purifiers. There are no studies to show that long term if you take the diseases will be less, but definitely I feel I would recommend that if you're staying in a city of Delhi, you can afford it, you should have an air purifier, especially if you are suffering from any chronic illness and you remain indoors. And when you have air purifier, you should keep the windows closed. You can have a fresh air every day for 5-10 minutes, but most of the time you should keep the windows closed. Then only you will have a great impact. Regarding another thing which I want to tell is that if you can, through your medium, if you can tell the government that now the summer vacation for children should be converted into winter vacation, because summer we have still the good air, although it may be hot, but still that is better than exposing children in this season, and they should have the vacation, the long vacation during this season, and slowly they should come down to that level that they have the vacations in winters.
So my last question to you is there any possibility of reversing lung damage because of the prolonged exposure of this high AQI?
It is impossible to reverse the lung damage. You can prevent further if you are really suffering and every year you feel miserably bad. I tell many of my patients to go to another city if it is possible, because if you're working it may not be possible. If you can shift out of the place, if there is a possibility, that is the only option. Otherwise you cannot reverse, you cannot do. Whatever damage has been done, it is all right. But if you stay in Delhi, you smoke, at least stop smoking, because that will definitely help you reverse further changes and have a good lifestyle. Do good exercise when the AQI is good. At least do insides, do some yogas, meditations, good amount of water. All these, put some plants, eat a lot of vegetables, fruits. They all will protect you and help you from the ill effect of pollution.
So that's all from my side. You have genuinely told the right thing to our audience, and I think it is a high time for us to take necessary precautions because I think the AQI level in here in Delhi NCR especially is much more higher than the human tolerance. So you heard Dr. Rajesh Chawla, who is a senior consultant, pulmonologist and critical care specialist here at Indraprastha Apollo Hospital. This is Kavya Khandelwal signing off with video journalist Varun Arora. You are watching The Edge.